Ever pondered the prevalence of respiratory tract infections in our everyday lives? Indeed, it's a common discussion in many medical circles and lay conversations alike. Diving right in, respiratory tract infections categorize into two main types: upper and lower. Each type bears its unique set of causes, symptoms, and treatments. Upper respiratory tract infections, or URTIs, predominantly originate from viruses. These microscopic invaders, including the common cold, influenza, and sinusitis, are responsible for the majority of URTIs. However, bacteria also play a role, causing infections like strep throat. Transmission typically occurs through inhalation of airborne droplets or by touching contaminated surfaces, then touching the face. Symptoms of URTIs present as a sore throat, runny nose, cough, headache, or fever. Ever had a scratchy throat or a persistent cough? These are the telltale signs of an upper respiratory tract infection. Treatment for URTIs generally involves managing symptoms and boosting the immune system. Over-the-counter medications can alleviate discomfort while the body fights off the infection. Antibiotics are only effective against bacterial infections, so they're not always the go-to solution. Switching gears to lower respiratory tract infections, or LRTIs, these affect the lungs and bronchial tubes. Pneumonia and bronchitis are classic examples. Like URTs, viruses are often the culprits, but bacteria and fungi can also cause LRTIs. Symptoms of LRTIs can be more severe, including a deep chest cough, difficulty breathing, wheezing, or high fever. It's not just a tickle in your throat, it's an infection that goes deeper, literally and figuratively. Treatment for LRTIs might involve antibiotics, if bacteria are the cause. Antiviral drugs can help in the case of viral infections. Hospitalization is sometimes necessary for severe cases, particularly in individuals with weakened immune systems. In conclusion, respiratory tract infections, both upper and lower, are common but treatable ailments. Viruses are the most common cause, but bacteria and fungi can also play a role. Symptoms range from mild inconveniences like a runny nose or a headache to more serious conditions like difficulty breathing. Treatment depends on the type of infection and its severity, but it often involves symptom management and in some cases antibiotics or antiviral drugs. So next time you find yourself with a cough or a tickle in your throat, remember this information. It's not just about knowing what's going on. It's about understanding how to manage it and when to seek medical help. And with that, you're one step closer to becoming an expert on respiratory tract infections.